How do you determine when it's safe for a patient to go home?
Before we will send you home to go home after the hospital, we want to make sure that you are safe and as comfortable as possible. What we mean by safe is that you are able to get in and out of bed by yourself with the assistance of a walker, but not with the assistance of a support person or a team member. The next step is that we want you to be able to do 100 feet with the use of your walker. Now that is literally going to be down a hallway at the hospital, making sure that you can do it. You will have someone behind you, but you won't have anyone supporting you because we want to make it sure it's just like you're at home. The next thing is that you want to be able to get dressed and undressed with minimal help. So we don't make you do everything totally independently. If you need some help getting dressed or undressed, that's completely understandable. We'll teach your support person how they can assist you doing such things. The same thing goes for getting to and from the restroom. We want to make sure that you're able to do that with minimal assistance. So again, a support person is able to do that.